Now, from WYDC TV, this is Big Fox News at 10.
Good evening. Thanks for choosing Big Fox News. I'm Nick Smith. We begin tonight in Steuben County, where the final draft of the Steuben County Police Reform Plan will soon be up for adoption by the Steuben County Legislature. Big Fox News reporter Matt Kleindus joins us in Corning with tonight's top story.
Good evening. After a 2-week public review of the new proposal, the legislators' Public Safety Committee was informed that the reform plan was approved. After months of review, the county sheriff's office has compiled a list of reforms to better serve the community. Reforms that are now in place include penalties against officers that cause serious injury or death using a chokehold. Police will also be required to file a verbal and written report for discharging their weapon, and departments must submit annual reports on arrest-related deaths to the state. Citizens that aren't under arrest have the right to record police activity, and courts will now compile arrest and court proceedings for low-level offenses, which includes information like race, ethnicity, and sex. In addition, investigations alleging police misconduct resulting in someone's death will be turned over to the state attorney general. The plan also includes efforts to increase open communication between the police and the public, as well as standardized procedures to file complaints against police officers across the county. Reporting from Corning, Matt Kleindens, Big Fox, WYDC.
The Trump administration ends in 12 days, but after the deadly riots at the nation's capital, some leaders are calling for President Trump to be removed before then. John Lawrence reports.
There's a new fence being erected at the Capitol, but it won't block out the memory of what happened Wednesday.
It certainly was a dark day for our democracy.
The day after inciting the crowd that stormed the Capitol, President Donald Trump denounced the rioters in a taped speech.
To those who engaged in the acts of violence and destruction, you do not represent our country.
House Speaker Nancy Pelosi and Senate Democratic leader Chuck Schumer are calling on Vice President Mike Pence to invoke the 25th Amendment, which could remove the president from office.
We are in a very difficult place in our country as long as Donald Trump still sits in the White House.
Adam Kinzinger was the first Republican House member to publicly support the idea.
The president has become unmoored, not just from his duty, nor even his oath, but from reality itself.
As the remainder of Trump's tenure is discussed, some members of the administration are resigning, including Education Secretary Betsy DeVos, Transportation Secretary Elaine Chao, and former White House Chief of Staff Mick Mulvaney, who was serving as a special envoy to Northern Ireland.
I can't do it. I can't stay. Those who choose to stay, and I have talked to a couple of them, are choosing to stay because they are concerned that the president might put someone in to replace them that could make things even worse.
I'm John Lawrence reporting.
As many Americans across the country continue to get vaccinated against COVID-19, some are hesitant to get in line. COVID-19 specialist Amanda Decker has a closer look.
We're learning new details tonight about how rural and urban America have been impacted by COVID-19 and how these two very different areas in our country have responded to the pandemic. Kaiser Family Foundation is out with the results of a recent study that looked at how rural Americans were responding to COVID-19, their level of fear about getting infected, and whether or not they plan on getting vaccinated. According to the Kaiser survey, Americans living in small towns have a very different attitude toward the pandemic than those living in large metro areas. Early on in the COVID-19 pandemic, our bigger city centers like Manhattan were hit hard by the sudden spike in cases. But last summer, that started to change across the country. As community spread in big cities started to slow down, cases in rural areas were ramping up. And by September, those smaller areas on average had twice as many deaths per capita as places like New York City and Chicago. Now, even 5 months after we saw that trend switch, large cities continue seeing ups and downs, but rural areas have continued seeing those consistent high community spread numbers as well as high numbers of deaths. Smaller communities face very different challenges than big cities. Many small towns lack access to hospitals or trained medical staff. But the biggest concern now is the vaccine hesitancy that we are seeing in rural communities. According to the KFF study, rural residents are among the most vaccine hesitant groups in our country, along with Republicans between the ages of 30 and 49, as well as Black adults. 31% of people in small towns say they will definitely get the vaccine, but in urban areas, 42% of people say they plan to get it. 35% of those living in rural areas say they will likely or definitely not get it at all. And the biggest reasons? They either don't trust it or don't think it's necessary. No matter where you live, at this point, you likely know someone who has been infected by COVID-19 at this point. But still, 39% of people in small-town America say they are not worried about getting sick. And in big cities, only 23% of people say they aren't worried. But as many as half of rural residents say the seriousness of the pandemic has been generally exaggerated. In urban areas, about 27% of people believe that theory. Now, the study also found an overwhelming number of people in small areas across America believe that getting vaccinated simply is a personal choice, compared to 64% of people in urban city areas who believe getting vaccinated is our duty to protect those around us in our community. I'm COVID-19 specialist Amanda Decker reporting.
New York City Police Commissioner Dermot Shea has tested positive for COVID-19. The department's Deputy Commissioner Richard Esposito released a statement stating in part, he's doing well, he's in touch with his executive staff on a regular basis, he's staying home, and he's running the police department remotely. In January alone, more than 400 members of the NYPD have tested positive for COVID-19. Chemung County opened its first vaccine site this morning. The site is located at the Arctic League headquarters in downtown Elmira. Vaccines are being given to people in Group 1A in the distribution plan, which includes hospital workers and nursing home residents. The county is looking to open up a second vaccine site within the next 2 weeks to ramp up distribution. A new study suggests that Pfizer's COVID-19 vaccine is effective against new coronavirus strains. 2 new strains considered more contagious were first identified in South Africa and the UK. Researchers at Pfizer and the University of Texas Medical Branch used a mutation found in both strains to create a version of the virus. They tested it against blood from 20 people who had received 2 doses of the vaccine as part of the clinical trial. Researchers found no reduction in neutralization activity. 2 Oregon hospitals tossing out doses of the COVID-19 vaccine after there weren't enough healthcare workers to vaccinate. Brianna Kelly has more.
At 2 different Portland hospitals, 42 vaccine doses were thrown out. A Legacy Health spokesperson says they lost 27 doses when they couldn't find healthcare workers to vaccinate. There's a short period of time in which the Pfizer vaccine must be given after thawing, and according to Legacy, no employees were available to take surplus vaccine before more than 24 doses expired. At OHSU, a spokesperson says they lost 15 doses as of a week ago. They ran into 2 different problems. 1 vial broke, which contained 5 doses, and 2 vials were mixed incorrectly. According to the spokesperson, OHSU's received 17,550 vaccine doses, and to date, they've given 11,000 shots. The Legacy spokesperson said those 27 expired first doses are out of more than 8,000 people they've given shots to so far. For some reference, after the vaccine's thawed, you only have 2 hours to use it, and it can't be refrozen. The hospital built their schedule of giving people time off for symptoms around receiving 5 doses per vial, but they're finding some vials contain 6 or 7 doses. The spokesperson says this means their inventory increased by 642 extra doses, which they've reported to the state. Legacy's adjusted their schedules in order to be more effective and reduce the chances of having a dose expire. They vaccinated over 8,000 people as of today. Brenna Kelly, Fox 12 Oregon.
Angry lawmakers from both sides of the aisle are asking tough questions and demanding better security following the deadly riot on Capitol Hill on Wednesday. Mark Meredith has more from the nation's capital.
They knew we were coming. Why didn't they have it guarded?
Lawmakers from both parties are furious with Capitol Police after the worst security breach at the U.S. Capitol since the War of 1812. At least 5 people, including 1 police officer, losing their lives as a mob of pro-Trump protesters stormed the building. The head of Capitol Police announced his resignation Thursday, and both the House and Senate Sergeant-at-Arms are stepping down as well. Some lawmakers claim they knew about the potential for violence and security should have been beefed up.
The way that we talk to each other, the way that we communicate, it has meaning, and people will sometimes take our words and our language literally, and we saw that.
But law enforcement officials are defending their performance. They say they had no prior indications of any type of organized violence, and their officers were overwhelmed and outnumbered.
There was no intelligence that suggested there would be a breach of the U.S. Capitol.
For now, Capitol Hill remains in virtual lockdown, the violence in D.C. prompting some states to reevaluate their own Capitol security procedures, hoping to give law enforcement more flexibility if protests get out of control in the future.
We can put certain protocols in place to be able to make sure everybody stays safe and that their voice can be heard in a safe manner.
A 7-foot-high, non-scalable fence is now erected all around the Capitol complex, and it's expected to stay there for the next 30 days. On Capitol Hill, Mark Meredith, Fox News.
The FBI is looking for the person or persons responsible for placing pipe bombs outside the Democratic and Republican National Committee offices on Wednesday. The agency released this bulletin. It's offering up to $50,000 for information on the suspect. Right now, it's unclear how the person in the hooded sweatshirt is related to the pipe bomb incidents. Still ahead tonight, chaos at our nation's capital this week. The images, hard to see, especially for children.
There are many teachable moments in this, and it's quite a challenge to show just enough of the information to be able to teach on, but not so much that you create a sensation of children not feeling safe.
Coming up, what parents should keep in mind when explaining these events to their children.
Here's your local stock market update from Big Fox. Now, your Twin Tiers forecast from Big Fox.
Tonight's Big Fox forecast is brought to you by William Attar. Good evening, everyone. I'm meteorologist Kim Walker with your weather update. Temperatures dropped down today. Highs only in the upper 20s and lower 30s. It was quite cold out there, and I don't have to tell you that if you've been outside. 5 degrees cooler in Elmira. And then 24 hours ago, 2 in Corning, 2 in Watkins Glen, around 6 in Ithaca. We are going to see seasonably cold temperatures for the weekend, so that cold air will stick around. But the good news is we should see some sunshine this weekend. However, clouds will start to thicken up on Sunday as another system approaches. So if you're trying to work out outside, it looks like temperatures will be a tad above normal for tomorrow. Our average high right now is 33 degrees. We will be around 34 degrees at noon. Plenty of sunshine during the day, highs in the mid to upper 30s, and then we drop back down to the lower 30s by the evening hours with just a few more clouds that will be moving through our sky. But again, we have another storm system that will be coming from the south as it moves away from the southeast and heads toward the Delmarva area. It will press a lot of cold air toward our area, and so I think the best chances of snow will be a little bit to our east. However, there still could be a few flurries that will be flying around during the day on Monday. Not measurable snowfall. That's not what it looks like right now, but things could change over the weekend. So tonight, bitterly cold air. We're looking at lows around 17 degrees in Bath as well as in Corning, 18 in Watkins Glen, just a tad better in Elmira, but still well below freezing with a low around 21 degrees, 21 also in Hornell. But we should see plenty of sunshine for tomorrow, and that will help to boost those temperatures upward. So we're looking at highs around 38 degrees in Corning, 36 in Elmira, 37 in Watkins Glen. But below freezing, though, for you in Perkinsville at 31 degrees. Those winds will also die down as well, and so it won't be a bad day overall. Even though our average highs are around 33 degrees, we're going to be a tad above that. However, by the end of the weekend, those clouds will start to increase, and so that will put a halt to our warming. So we only muster up to around 34 degrees, 37 for your Monday. However, there could be a few flurries flying around. It's going to be a kind of a dreary day at that as well. But then on Tuesday, it looks like that sunshine will return. Temperatures once again will be in the upper 30s. And if you take a look at our highs on Thursday, it looks like things will be just a little bit better. We do start off pretty cold though, 27 degrees on Thursday, highs around 41 degrees, and there will be a few passing clouds in our sky. However, moving toward the end of the week, we have yet another storm system that will come through, and that will bring the possibility of more snow showers, and those temperatures will drop back down, highs in the upper 30s.
The scenes are scary chaos in our nation's capital this week, and they can bring up a lot of emotions when you see images like this. And talking to your children about it can be really tricky. Mandy Gaither takes a look at how you can approach this subject with your kids in today's Health Minute.
Riots and destruction, anger and fear. Americans watched an attack on the nation's capital this week by supporters of President Donald Trump. The image is hard to see, especially for children.
There are many teachable moments in this, and it's quite a challenge to show just enough of the information to be able to teach on, but not so much that you create a sensation of children not feeling safe.
Ken Yeager, director of the Stress, Trauma, and Resilience program at the Ohio State Wexner Medical Center, says whether to show what happened to the youngest Americans depends on the child based on age, maturity level, and other factors. He says if you do decide to share what's going on, listen to what the child has to say.
And I think it's important for adults to acknowledge to their kids, I'm having some of the same feelings you are too. Maybe not to the same degree, maybe to a greater degree, but assuring the child that this is a normal response to an abnormal circumstance.
Yeager also says to limit exposure so that it's not overwhelming and make your child feel safe by grounding them in the moment.
Just because there are bad things going on around you doesn't necessarily mean it's coming directly toward you.
Finally, when it comes to feelings about these images, let your child know they can always come to you to talk.
A Kentucky community comes together to help a young girl raise money for her father's funeral after he died in a car accident. John Bowl has more on her inspiring story.
Daddy'd be proud of you. I know he would already.
We asked 9-year-old Kaylee Miller what her dad meant to her. The answer was short and sweet.
Everything.
That's why she's doing everything she can for him. Kaylee and her dad loved to bake together. Now that he's gone after a car accident on Sunday, she's using her love for baking to raise money for his funeral.
There's 7, there's 8, there's 9, and there's 10. God bless you. Here's your hug.
People lined up in front of Kaylee's homemade popcorn, brownies, and cookies. One couple giving the family $1,000 in exchange for 2 chocolate chip cookies.
You saw that the pandemic won't stop us from still caring about other people. You saw us paying forward. And you saw what Wave 3 News can do.
Jack and Debbie say they know the pain Kaylee's going through.
I was in the 3rd grade when my dad died.
As for Kaylee, she's thankful for the community and knows her dad would be proud.
Just grateful and just like, I cried yesterday because of all the people that actually cared.
A North Carolina family is given dire news about a loved one battling COVID-19 in the hospital. But while the doctor was telling the family to say their last goodbyes, the patient had other plans. Caitlin Penter takes a look at his remarkable recovery.
The last I seen my son, he was blowing me a kiss, and then they cut the iPad off because then they were venting him.
After 41 years of being inseparable from her son Mark, Barbara Stiles says a COVID diagnosis at Thanksgiving took him away from her. Mark has Down syndrome.
He was begging, my mama go, and so they let me stay with him till they rolled him out.
Barbara says Mark was placed on a ventilator at the beginning of December at Mission. Due to COVID protocols, she nor any of her family have been able to visit.
We're lost, because he is our rock.
Barbara says after a few weeks, doctors told her it was time to take Mark off the ventilator and let him go peacefully.
We were going to do that.
Barbara says the night before they were going to do it, he became responsive.
A nurse called me and she said, Mom, Mark's having a bad night. He's got tears. And from then on, I hung on with everything in me.
Somebody wants to talk to you. Who's that?
Mark. Hey, baby. Has he got that out of his mouth?
Yep.
And he's doing okay like that?
Yeah, he's doing really good, actually.
Mark has since been taken off the ventilator and is doing better.
But I called FaceTime last night, and he spoke to me. He told me he loved me.
Barbara says he still has a long way to go. She says they still don't know how Mark got COVID since they've been so safe.
This is a horrible disease.
and once he comes home, I'm nailing the doors and the windows shut. And it'll have to be dropped in by our mail.
But now she says thanks to her little miracle, she's no longer waiting for a goodbye, but instead, hello.
Hey, buddy.
Caitlin Penter.
Hey, Mama's baby.
News 13.
I love you.
Hyundai stock skyrockets today after reports the company is in early talks with Apple to start developing self-driving electric cars. Several news outlets are reporting the South Korean automaker confirmed it was in talks with Apple. In a statement, Hyundai says it was receiving proposals for cooperation from several companies, but no official decision has been made yet. Apple is declining to comment. A federal medical team is helping out with the COVID-19 surge in California. 2 facilities in San Joaquin have now been able to double their ICU capacity thanks to the extra help. These teams arrived about 2 weeks ago, and Emily Maher talks to one of the doctors who is working on the front lines.
I am an ER doctor in the Air Force.
Walking into Dameron Hospital in Stockton.
Meaning that I work in the emergency department seeing all patients that come in the doors.
Captain Alexa Gingras says she's proud to help.
I was excited. I think that it's always a good opportunity to go help a community in need, and that is definitely the case here at Dameron.
San Joaquin County's hospitals are overwhelmed by the surge of COVID-19 patients. The demand for intensive care services is at a near record high. Hospital ICUs are operating at more than 1.5 times capacity.
We are running quickly out of space there.
Brooke McCullough is the operations executive for Dameron and Lodi Adventist, the 2 hospitals getting help from the federal medical team. She says because of them, both hospitals have doubled ICU capacity.
It's also allowed us to accept transfers from other hospitals in the community and really be, the place where people can come for relief if they need a place for their patients.
We're definitely busy, and the people here work very, very hard.
Gingras has been working here for almost 2 weeks.
I show up and for 12 hours am working alongside the local providers here, seeing everybody and anybody that comes through the doors.
1, 2, 3, 4. Video from the Department of Defense shows other members of the team getting prepared to help. Gingras says the support they've received from hospital staff and community is overwhelming.
It's been very, very obvious that they were tired, but these people are really resilient, and they are so appreciative that me and everybody else that came along with me is here to get down and dirty and help.
In Stockton, Emily Maha, KCRA 3 News.
We want to leave you with a smile tonight. A beloved former teacher in small Minnesota town has been immortalized in a very Minnesota way. He's at a snowy sledding hill named after him. Residents say 90-year-old Dean Conklin, who is also a town councilman and business owner, is pretty much a local celebrity. So much so, a 5-acre plot of land that Conklin recently gave to a former student has now become a tribute to him after it was turned into a sledding park and officially renamed Conklin's Hill. Along with more than 100 residents, Conklin himself turned out to test the hill out. Have a good night. Thanks so much for joining us.